afternoon. My name is April Holman. I'm the Executive Director of the Alliance for a Healthy Kansas. This is the third installment of our Facebook Town Hall series. Our goal for this series is to elevate the work and concerns of our coalition partners during the COVID-19 pandemic and to identify the ways that Medicaid expansion could help healthcare consumers, providers, and state and local economies to respond to the challenges created or worsened by the pandemic. Today's town hall will focus on the federally qualified health centers and other community care clinics in our state and how Medicaid expansion would affect them. We have two guests with us today, Denise Sisman, the CEO of the Community Care Network of Kansas, and Amy Falk, the CEO of Health Partnership Clinic and the President of the Community Care Board of Directors. Thank you for your partnership in the movement for Medicaid expansion and for taking time out of your day to share more about the challenges facing clinics in the current health crisis. I'm just going to say, for those of you who might be watching, we did run into some technical difficulties today, so this session is recorded. But if you have questions, we will be monitoring our Facebook feed. So please go ahead and type in a question, and we will get the answer to that for you. So that would be also, if you have questions for Denise and Amy, we can follow up with them to get you the answers that you need. I'd like to start with a question for Denise. Could you share a little bit about the Community Care Network of Kansas and the work of your members to provide access to affordable care in our state?
Yes, April, thank you for inviting us here today. It is an honor to be a partner with the Alliance for a Healthy Kansas, and we're looking forward to having this important discussion. The Community Care Network of Kansas is a statewide organization that exists to serve a network of federally qualified health centers, or what we commonly call community health centers, as well as other nonprofit primary care and dental clinics. What's important about the network is that the statewide organization, Community Care, as well as all of our member clinics, are striving to achieve a common purpose, which is to assure equitable access to high quality health care for all Kansans. The Community Care Network of clinics includes 34 different clinics that serve 1 in 9 Kansans. This is an extensive primary care network that also provides other kinds of healthcare services like dental services, behavioral health, which is mental health, and substance use disorder services, as well as many have in-house pharmacies, and they provide labs and x-rays, and all also provide support services to help Kansans that are having some challenges with maintaining and achieving and maintaining health based on those life circumstances called social determinants of health. The network has been around for about 30 years, and this year we were able, the clinics were able to provide over 1 million visits to all Kansans. What is also important to know about the network is that all of these clinics provide high quality health care to every Kansan that is interested in receiving care, regardless of their ability to pay. So no matter who you are, where you live, how much money you make, or if you have health insurance, you know that you can count on a member clinic of the Community Care Network to receive high quality health care that is focused on the mind, the mouth, and the body. So Amy Falk is here with us today, and she is our board president as well as CEO of one of our larger health centers. And Amy, I'm wondering if you would like to share your perspective of what it's like at Health Partnership Clinic.
Sure. Thank you again for the opportunity of reiterating Denise's points of the importance of this conversation. Health Partnership Clinic has been around for almost 30 years, and we provide care in 3 counties. We have 3 physical sites in Johnson County, Kansas, one of which is a school-based clinic. And then we also have clinics in Franklin and Miami counties. At our clinics each day, we provide medical care ranging from chronic disease management to acute care, well women visits, but we also operate an integrated model where we come behind the medical visits with supportive behavioral health care. We also provide dental services within our main clinic, but also do a large amount of dental outreach into the community and schools. Most recently, we added substance use disorder treatment, and a couple of months ago, even added medication-assisted treatment to serve the individuals of our counties.
Wow, that's, you guys are doing a lot. And I think that there are probably people who are listening in who didn't realize all of the ways that those clinics that are part of your network are really there for people in Kansas who need access to care. I'm really grateful that you all are sharing this information. Obviously, we are experiencing a pandemic in our state, and that has probably impacted not only your work, but the work of a lot of healthcare providers across the state. So I'm just curious, as we are, I think I'm going to get to a question in a minute that talks more about maybe ways that you're changing the work that you're doing. But first, could you tell me a little bit about how Medicaid expansion might help federally qualified health centers and other clinics during the pandemic, and what we expect will probably be a slow economic recovery afterwards?
So Amy, do you want to start and I'll add?
I think for us, the pandemic, what Medicaid expansion would have meant for us is really around, when we look at our patient population, currently about 60% of our patients are uninsured. So with that, as a business, we will work on very thin margins and reimbursements. So when the pandemic hit and our patient visits decreased to almost 41% of what they used to be, obviously revenues dropped, and this could have a dramatic impact on the care we provide. If Medicaid had expanded, just roughly doing estimates around the patient population we serve, Health Partnerships Clinic would stand to gain about $1 million extra a year, which could be put not only back into patient care, but also to build those reserves for situations like this. Hopefully we'll never encounter them again, but this could be a long haul, and having those extra resources would ensure that we're there to continue care to our patients.
And if I could add to that, when you are looking at serving patients, it certainly is a lot easier and really more effective and more economical for the clinics to serve individuals in a preventive way, to help them diagnose conditions early on, as well as then to get the kinds of chronic disease management and other types of support to achieve that optimal health. And we know that when people don't have insurance, like the 150,000 Kansans who currently are falling in the gap, that they're more likely to delay seeking care. And what that means then is that individuals, when they do go to seek care, they come to the clinics or the health centers later in their disease process. They're often sicker, they may need more expensive and more extensive type of treatment. And overall, it just costs the individual as well as the entire system, or the health center in this case, a lot more money. And so whether we're looking at COVID-19 or we're looking at diabetes or hypertension, or helping to make sure that our children, our babies and children stay healthy as they grow and develop, it's important to be able to serve the people as early as possible and to help them get that optimal level of health. And in the absence of health insurance, that's just a real struggle. People are having to make day-to-day life decisions of, do I pay this bill? Do I pay my rent? Do I buy food? Or do I go and see the doctor?
Yeah, there are some really tough choices that people are having to make. And I think that, that kind of brings me to the next question that I had, which is, have you been forced to do business differently in light of the pandemic? Has that changed the way that you operate, or possibly the way that you are serving your health centers, Denise?
Mhm.
Or
Yeah,
Amy?
I'll talk about this from a global way, and then Amy, if you want to chime in, feel free to and share your perspective. When I think about this, I think about it in terms of, and wow, hasn't the COVID-19 pandemic affected all of us in ways that we had never imagined? But I do think about this for the health centers and the clinics that we serve in four different ways, or in three different ways. One is who they're serving and how they're delivering services. And the second is, what does that mean for them as they all are employers? And in some communities, they're one of the larger or largest employers. And then third, what does it mean for them to be a business? And Amy talked a little bit already about the fine margin that they have in terms of finances and the need to make sure that you get as much revenue as you can to support all the kind of care that's provided. And so when you look at who are they serving and how are they delivering services, we know that almost immediately, all of the health centers and community care clinics switched from providing that routine, ongoing, non-urgent care that you often, all of us will receive as we go to the doctor or go to the dentist or go to our mental health providers for ongoing care. If we have diabetes, we're there every quarter or every 6 months to make sure that things are going well, for example. And they switched that to providing and focusing on COVID-19, and rightfully so. So they were there in their communities to help with testing. They were there to help with diagnosis, especially for people who have mild to moderate symptoms. And they were there to then refer to the hospitals for individuals that were having more serious complications as a result of COVID-19. This was almost an immediate switch, which is hard for any business to go from point A to point Z, in a matter of days. And I'm so happy and proud to say that they did a phenomenal job of doing that, and it was absolutely necessary. One of the nice parts about all of this, in addition to serving the individuals and serving Kansans, is that also they are helping to relieve some of the burden from the hospitals. So people aren't necessarily having to go to the emergency room to get tested or going to the emergency room with mild and moderate symptoms. And those that do go to the emergency rooms are those that are really facing the serious consequences from this disease. At the same time, patients still have non-urgent needs, and they can't be ignored. People with diabetes still need to see their physician. Babies and children still need to get immunizations. And so what the clinics have also been able to do is switch how they are delivering those services. So they're now doing a lot with telehealth, and they are able then to provide routine monitoring through phone calls, through things like Facebook and other kinds of audio-visual techniques and processes, and then able to be there to help direct and prescribe medication, for example, and direct the care. Additionally, we can't forget that they're all employers, and so they have people, they have healthcare workers. These are the folks that you hear about on the radio, you see on the news, they're on the front line. And as employers, it's especially important that the health centers and community care clinics do all that they can to make sure that their employees are protected and safe, as well as the patients. And we know that that has been a real struggle with PPE, personal protection equipment, being at having such a shortage, as well as just having the necessary supplies for testing, for example. Employees, like all of us, are scared. They're uncertain. In some cases, employees have been diagnosed with COVID-19. Their families have been diagnosed with COVID-19. And so they're facing the same kind of stresses that we are. Yet the clinics have to remain open, and they have to continue to provide services as possible, just now focused on COVID-19. And that leads me to the third point, which is they are businesses. And so imagine if you were a restaurant and you lost 60% of your business pretty much overnight, maybe within a week. And yet you were required to stay open and to keep all of your employees on staff. How do you do that? And how do you keep yourself in a situation where at the end of this pandemic, you are there and ready to go back to what is ever considered the new normal at that time? And that's what the health centers are looking at as well. So they've lost 60% of their their visits went down by 60%. They are losing some staff. We have about 6% of the employees that are unable to work right now because of COVID-19. And yet they are still maintaining a high capacity, doing what they can, whenever they can and however they can. And they will be here. They will remain financially strong with the help of foundations and other funds and a lot of support from the local community to be here when the pandemic is over and if the pandemic is over, and to provide the services that are needed at that time.
And I might add, from Health Partnership Clinic's perspective, yes, it was like turning a light switch on overnight. We had to revamp our entire system of care, looking at, focusing on what is best for the patients in our communities, but also our staff. So that really turned the focus onto how do we rise to meet the challenge of COVID-19, whether it was setting up a COVID-19 hotline where individuals in the community could call, ask questions. We have specifically designated COVID-19 appointments, sick rooms set aside. But at the same time, as Denise stated, we still have patients with other needs. So we were very fortunate in that we were already offering telehealth services to some level through our behavioral health program. So basically in a period of 10 days, we were able to switch from that to opening this telehealth virtual visits, whether it's a phone call, but also to our patients for medical visits, offering medical visits to both our pediatric and our adult populations. We also expanded that to our substance use treatment program, so that those group visits could continue on and those one-on-one, so that treatment therapy wasn't disrupted during this critical, stressful time period. That was a huge shift for us, going from that in-person meeting to the virtual meeting, but it helped ensure that our staff also remained safe, but the individuals also in the waiting room. Another thing we looked at is how do we continue to meet the needs? Kids still need their vaccinations. So staff has been going through gap list, who needs their vaccines. So in the upcoming weeks, we're figuring out how we can do maybe drive-through by appointment for our current patients to get their vaccination so that they're ready for school when school hopefully starts in the fall. So it's been a very busy, hectic time, and the healthcare workers and staff throughout all of the FQHCs are really the heroes, meeting the need day after day and not complaining, but doing what needs to be done for our patients.
Yeah, I mean, I even just today doing this very small Facebook Live event, we have encountered technical difficulties. And so I can't imagine the stress that's added to all of the people trying to provide care virtually for those more standard visits. And then in addition to that, the very serious threat with the COVID-19. So my hat is off to you and to your clinic partners. And we're just so grateful that you all are out there. One thing that I wanted to ask, and this really could be for either one of you, thousands of people across the state have lost their jobs just in the last month, and we know that that may continue to happen. So in many cases, those people have lost their employer-sponsored health insurance as well. Is there anything that you can tell people to help them understand how the federally qualified health center system is positioned to uninsured people, both to find their nearest clinic, but then also to figure out what their options are?
I would say that FQHCs are in a unique position to help individuals. The majority, if not all of us, have what used to be called navigators, but now patient assisters to help enroll patients in both the Medicaid program, but also marketplace insurances. So we have that resource available to individuals, and I would strongly recommend if someone finds themselves in that situation that they go online. Community Care Network of Kansas has a great website where you can find the nearest clinic. Find your nearest clinic and contact them and set up an appointment. I can tell you that our assisters, from when this really started evolving and layoffs started occurring, have been probably busier than they've ever been, trying to help meet those needs of the individual. In preparing for this and speaking to our assister, one of the key points she said was the unfortunate thing is that a lot of these individuals who have lost their jobs are falling into the gap. We can't help them because Medicaid has not been expanded. So the number of those individuals who could be helped by expansion during this critical time are the ones that are falling through the cracks.
I would add to that, Amy, the ones that are having some pretty serious economic consequences in their
Yes.
life. And so,
Absolutely.
yeah, and if you even look like I need to go to get tested, who's going to pay for that? Now, thankfully, right now, the federal government has a program where they are providing free testing for people without insurance, and they are providing free care. That's not going to be around forever. That's limited. And so for the recovery being as slow as we think it will be, we're going to have to be helping individuals without insurance who fall in the coverage gap, that even with an assister there to help them, they would not be able to access. Yeah, so I think that's where knowing this network of 34 clinics that have over 100 sites, about half are in rural and frontier counties. They already are serving individuals without insurance. We're statewide, about 36% of patients do not have insurance, and about 90% are living right around the poverty level or below. So this network is strong. They serve all Kansans, but they specialize in serving those who are our most vulnerable and are often underserved. So we've just added to that 150,000 with COVID-19, the 150,000 individuals, Kansans, who are in the coverage gap. And we want to be there to do everything that we can. And we hope that those individuals who are newly unemployed and have lost insurance are able to go back to work as soon as possible. But do know that we are there for you, and we have easy access to our website, communitycareks.org. So that's again, communitycareks.org, where you can find a clinic that is close to you.
And we're going to put that in the comments for the Facebook Live session as well. So if you need help getting to that website, go ahead and look in the comments and you'll find a written version of that as well. Mm-hmm. Is there anything else that we might have missed that you all would like for listeners to know about the Community Care Network of Kansas, or the benefit of Medicaid expansion to your members, or the way, potentially that the public could help with the important work that you're doing?
So for me, April, it goes back to the importance of Medicaid expansion. And as you know, and many people know, the Community Care Network of Kansas, along with the member clinics, have had Medicaid expansion as one of its top advocacy priorities since the very beginning. For a lot of the reasons that Amy mentioned, for reasons that we talked about today, expansion can help individuals, it can also help the clinics, it can help the state of Kansas. In my mind, COVID-19 is shining a spotlight on the fact that we have not yet expanded CanCare. And so we can imagine that if we had, more individuals would have insurance. And as they're trying to deal with COVID-19 or worrying about COVID-19 or actually experiencing symptoms and having COVID-19, they would have the insurance that they need in order to get tested, to get treated, and to become as healthy as possible, which includes for some dealing with complications that might be longstanding. In the absence of that, you have, again, individuals who are more likely to delay care, delay testing, delay getting their symptoms managed and getting the treatment that they need. In any case of in all cases that the health centers are dealing with, if you look at diabetes, hypertension, obesity, those are all also considered epidemics, and they're ones that are also challenging for individuals without insurance, and delaying treatment can be life-threatening. With COVID-19, you have an extra special little twist to the story. If you delay getting tested and you delay getting treatment, you also are likely to be infecting other Kansans. And we're going to see the pandemic grow in Kansas as a result of individuals lacking access to health insurance, even with us having some of that federal support. So this is our time. This is our lesson to be learned, and we can move forward with being ready for future pandemics, as well as serving our Kansans in the best way possible by expanding CanCare this year. It's not too late. We can do it, and we can make a difference.
I would just add that expanding CanCare is really the right thing to do. When you walk through any of our clinics' waiting rooms and you see our individual patients needing care, you know, some with very advanced disease states, and it's heartbreaking to see that if those individuals had had coverage, they could have received the right care and, you know, had a much better quality of life. CanCare expansion would mean so much to not only those individual patients, but the providers who take care of them. You know, they hit walls consistently of, I have a patient with an advanced disease state, but I don't know where to send them. Sometimes a lot of care, especially cancer care, is out of reach if that individual does not have coverage. So I would encourage anyone and everyone, reach out to your representatives and talk about the importance of this. I think one of the things that COVID-19 has highlighted is, in this tenuous situation, we all could find ourselves in a position where we might need coverage outside of the typical employer coverage. So we need that safety net to be there for everyone.
Absolutely. Well, I couldn't agree with you more. And I just would like to say we're honored to work with organizations like the Community Care Network of Kansas, are just providing crucial services, and particularly in these difficult times. I want to thank Denise and Amy for participating in our town hall and for your tireless efforts to meet the healthcare needs of our state. I want to thank you also for your patience with us as we have navigated through some challenges logistically this morning, and your good nature with that. I just want to close with this thought. Kansas is one of only 14 states that have not expanded their Medicaid programs. And this is a simple policy change that will provide a major tool for the state, healthcare consumers and providers like community health clinics during the economic fallout and recovery from the pandemic. We hope that listeners might be moved to contact their Kansas legislator and urge them to pass Medicaid expansion when it's safe to resume the legislative session. Thank you again for being with us today, and we'll look forward to seeing you next week. Thanks.